Question 1. A 32-year-old woman presents with recurrent miscarriages and a recent episode of deep vein thrombosis. Her medical history includes systemic lupus erythematosus. Laboratory workup shows a positive lupus anticoagulant and anti-beta 2 glycoprotein 1 antibodies. Which of the following best explains the pathophysiology of her condition? A. Immune complex deposition in small vessels. B. Autoantibody-mediated inhibition of platelet aggregation. C. Autoantibody activation of coagulation through endothelial cell disruption. D. Deficiency of protein C and S. E. Increased fibrinolytic activity. C. Autoantibody activation of coagulation through endothelial cell disruption. Explanation: Antiphospholipid Syndrome APS involves autoantibodies like anti-beta 2 glycoprotein 1 that activate endothelial cells, platelets, and complement, promoting a hypercoagulable state and leading to arterial venous thrombosis and pregnancy loss. Why not the others? A. Refers more to lupus nephritis, not APS thrombosis. B. APS promotes, not inhibits, platelet aggregation. Protein C and S deficiency are inherited thrombophilias, not autoimmune. E. APS decreases fibrinolysis, favoring clot formation. Question 2. A 29-year-old woman has a history of 3 consecutive first trimester miscarriages and presents with a new left leg swelling. Doppler ultrasound confirms a DVT. Her labs show positive anti-beta 2 glycoprotein 1 antibodies and lupus anticoagulant. Which of the following is the most appropriate long-term treatment to reduce her risk of future thrombotic events? A. Warfarin with INR target of 2-3. B. Daily aspirin only. C. Heparin bridge followed by clopidogrel. D. Direct oral anticoagulant, DOAC, such as rivaroxaban. E. High-dose corticosteroids. Correct answer: A. Warfarin with INR target of 2-3. Explanation: the standard long-term therapy for APS with thrombotic events is warfarin, vitamin K antagonist, with INR 2-3. Heparin is used acutely, but warfarin is preferred for long-term secondary prevention. Why not the others? B. Aspirin alone is insufficient for patients with thrombosis. C. Clopidogrel is an antiplatelet agent, not first-line for venous thrombosis in APS. D. DOACs are not recommended in APS with triple-positive antibodies, including anti-beta 2 GPI, as they may be less effective. E. Corticosteroids are not useful for primary thrombotic APS unless there's active SLE.